Every single day, more than 50,000 people are told that they have kidney disease, and none of them saw it coming. What if that person was you? Your first thought would probably be, how serious is it, and can it be fixed? The problem is that most doctors would say that there's nothing you can do, that it's a chronic condition, and more often than not, it will get worse. But what if that isn't the whole truth? What if most doctors just repeat what they've been taught without really looking at the root causes of kidney disease in the first place? Because the real story is that 99% of early kidney disease can actually be reversed. So when we talk about early kidney disease, we have to understand what it is and what the different causes of kidney disease are. So, first of all, you can have a genetic defect. Now, that's pretty rare, and there's not a whole lot you could do about that. But you could also get infections, and you could have autoimmune attacks on the kidney. There's also things like kidney stones and kidney cancer, and you could have toxicity in the kidney, as well as hypertension and insulin resistance and type 2 diabetes. And these causes account for virtually all of the cases of kidney disease. But we want to split this in two categories. And above the line, we have the genetic, because that is something you can't do much about, because if it's genetic, if it's a congenital abnormality, you were born with it. However, everything below the line you have some control over. They're not completely random or set in stone. And these are things that you can help. You have some control. And if you look at the scale over here, the white would indicate both that it's sort of rare and that you can't do much about it. Whereas the bottom of the scale, the red here, indicates that it accounts for the vast majority of cases. Plus, it is something that you have control over, so that's a good thing. The more cases that are accounted for by that cause, the more control you have. And the bottom two here account for about 75% of all cases of early kidney disease. So let's go through the stages just so we understand what we're talking about and what constitutes early. So stage 1 of chronic kidney disease is when you have a filtration rate, an estimated glomerular filtration rate based on a calculation of creatinine, and that eGFR should be 90 or above, and that's milliliters per minute. That is optimal. That's what you're supposed to have. Stage 2 is when it's dropped below 90, but it's still above 60. Stage 3, they divide into two parts. So 3A is when you have between 60 and 45. Stage 3B is when you're between 45 and 30. Stage 4 is when you are below 30 but above 15. And stage 5, which is considered kidney failure, not just kidney disease or kidney stress, but failure. And that's when you're below 15 milliliters per minute. So I created that color scale just to kind of let you know how severe each different stage is. But what is it going to take when you have a blood test for them to give you a flag, for them to signal and say, hey, this is abnormal, this is a problem, and we call that a flag on a blood test? Well, stage 1 is optimal, so that's not going to get a flag. But here's the funny, or not so funny thing, stage 2, which indicates that yes, you're really starting to have a problem. That is not going to get a flag on a blood test. It is not until you get under 60 that you get a flag on the blood test. So even though they all agree that it's supposed to be above 90, you're not going to get a flag until you're like 59 or below. And then obviously anything that is more severe than that is also going to get a flag. But here's the curious thing, the thing that makes absolutely no sense when it comes to classifying these things. Why is the optimal level called stage 1 kidney disease? Okay, I've never been able to figure that out. So, that's one very strange quirk. And then, of course, the second one is, once they get to the next stage, why is it still not a flag? Why do you have to get into more severe levels of kidney disease before it's even noticed? And most doctors are not going to talk to you about the kidney if it's above stage 3A. But when I talk about early kidney disease, I'm talking about the first 3 levels. If you have stage 1, 2, or 3A, that is still, in my opinion, early. Those are things that for the most part can be reversed and prevented. And then let's talk about the standard treatment. And for stage 1, obviously there's nothing. But the problem is that stage 2, there is also nothing. And there's a long way to go from 90 milliliters down to 60. So that's a lot of prevention we could do if we understood that, where this was heading. Now, stage 3A, now they're going to start looking at some medication. They're going to look at your blood pressure medication. Probably you're going to have high blood pressure at this point. And they're going to be looking at things like metformin if you're insulin resistant, or insulin if you're a full-blown type 2 diabetic. And then it doesn't really change much. And they're not really treating the kidney per se. They're just giving you medication to treat the associated diseases, the diseases that come along with it. And for stage 3B and for stage 4, there's no change. They're just going to still keep working on these metabolic diseases. And they're not going to address anything as far as the kidney. They're going to help lower your blood sugar, but they're going to make you more inflamed and more insulin resistant. And then in stage 5, now your options are basically dialysis or transplant. And let me mention also that when I talk about 50,000 cases of kidney disease diagnosed every single day, what we're talking about is the area in gray here. Except stage 1 and stage 2, they're not counted in that number because they're not told anything. So virtually all of the people who get diagnosed are going to be in stage 3A and maybe some in stage 3B. By the time you have stage 4 and 5, you're going to be so sick that you know about it. It's not going to be a surprise because you're going to have a full symptom picture already there. So, the vast majority is going to be stage 3A, and the 50,000 do not include the stage 1 and the stage 2. But here's another thing that I really don't understand. It's in the very name. Why is it called CKD, chronic kidney disease? They've already put it in the name that it's chronic, that it's ongoing, that it can't get better. And the worst part, obviously, is in stage 1, when you're still healthy, when everything is normal, you still have stage 1 chronic kidney disease. Go figure. So you basically have this chronic disease before it even begins. And then once you drop down a little bit to stage 2, now you have a chronic disease from day 1. And then obviously as it goes on and as it progresses now, it just gets more and more chronic until you have kidney failure. And I think they name it that way because the entire sick care model is so set on treating symptoms. And they never ask, really, where are these things coming from? And can we change them? And even if they understand where they come from, they assume that people don't want to change, that they don't want to take care of themselves. So, let's talk about some of the real root causes. And we mentioned before, and I just want to throw this in very briefly, that we do have genetics, we have infections, we have cancer, and we have autoimmune. Now, relatively speaking, these are more rare than the ones we're going to talk about. But also keep in mind that even if you have a genetic defect, even if there's something wrong with your kidney from birth, or if you only have one instead of 2, the lifestyle choices that you make is still going to help that kidney work better. And even if you have infections, or cancer, or an autoimmune situation, the better you take care of yourself, the better your lifestyle is already or after the fact, the better you're going to be able to handle. The less likely you're going to get an infection, the less likely you're going to get cancer. But even if you end up with those, your body is still going to be able to take care of it better if you take care of yourself. So the number one cause of kidney problems, kidney disease, is high insulin, which leads to insulin resistance in the long run. And what happens with insulin resistance is, of course, that we develop high blood sugar, high blood glucose. And with that, we're going to increase inflammation in the body. And we are oftentimes going to develop hypertension because insulin resistance is the number one cause of high blood glucose, chronic low-grade inflammation, and of high blood pressure. And then these three things in turn are what causes the physical damage that causes the inflammation and the scarring, as the kidney, the tiny tubules as they try to heal. It can cause scarring when we have repeated damage. The second biggest root cause is junk food, poor diet, poor lifestyle. And first of all, obviously these processed foods will lead to insulin resistance and high blood sugar. But there is more to that because one of the main jobs of the kidney is to balance minerals, to balance electrolytes in the body, and especially the balance between sodium and potassium. Now, if you eat whole food, if you eat real food, the way that it has developed and grown on planet Earth, whether it's a plant or whether it's an animal or anything else that you find to eat, then in nature, the potassium is always going to be much, much higher than the sodium. And these foods are also going to have magnesium along with other trace minerals and calcium and so forth to balance out the bigger picture. But now, if you eat processed foods like a lot of people do, then the picture changes completely because now sodium is going to be much, much higher than potassium and any other mineral. So sodium's going to be sky high, which isn't a bad thing in itself. It's like you don't have to read into that. Sodium is toxic, and you need to keep it below so many milligrams. You can go ahead and salt your food as long as you eat whole food. But the problem with processed food is that it's depleted. And the only thing there's a lot of is sodium. Potassium is much lower in processed foods. And there's much less magnesium and calcium and trace minerals. And there's really nothing at all to balance out that sodium. And not only that, it's not just all the sodium chloride that they add, but a lot of food additives are also going to have sodium, like sodium phosphates and sodium nitrites, etc. So all of these three factors here is going to further unbalance the whole kidney situation, what it has to process, and it's going to cause additional stress for the kidney. But again, the sodium in itself is not the whole problem. The problem is that we're not getting the balance of electrolytes that we need. And the only time that you have to really limit your levels of sodium and also potassium is if you're in the more advanced stages of kidney failure like stage 3B, stage 4, and stage 5. Because now anything that you put in is not going to be properly processed and filtered and regulated. So that's the time that you have to cut back and limit those. And the third root cause of kidney failure is chronic dehydration. And what happens now is if you don't have enough water to dilute your body fluids, if you're chronically dehydrated, now you're going to concentrate the toxins and the wastes. And this makes it much more difficult for the kidney to process. And you're adding stress to the kidney as well as the potential for more kidney stones. So, the hydration could be because you're not drinking enough water or you're losing a lot of water, but it could also be that you're hydrating wrong. If you're drinking water straight without adding any minerals or electrolytes, what happens is you're gradually just diluting the electrolyte pool in your body, and you're becoming more and more deficient. And not only that, but the kidney has to work harder now to try to recycle and to capture all those electrolytes, or the few electrolytes that you have left. And this is why there's so much talk about hydration and electrolytes these days. And most of the talk is in the sports world because they want to perform well. They want to make sure that they have the energy and so forth. But it is reflected in kidney health as well. But we have to realize that there are different types of electrolytes out there, and there are some that are fairly pathetic. They either have virtually nothing in them, or they have a combination where 95% of what's in there is just sodium. It's just table salt. And because there were so many poor quality supplements out there, I created what I felt is the most complete and the best value of an electrolyte anywhere out there. And it's called Ulite. I'll put a link down below so you can check it out. And I challenge you to do the research and compare the numbers and the pricing, and you will probably find that it is the most complete and the best value. The fourth biggest root cause of kidney failure is medication. And a lot of people are using medication like candy. They take it much too often. And we're talking about the NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. And what these drugs do is they restrict blood flow to the kidney. So when you take them, there is less blood flow going to the kidney. And this is the blood flow that is going to feed the kidney. So the kidney filters blood for the rest of the body. But a portion of that also goes to feed the kidney itself and to heal the kidney and provide all the nutrients and the energy for it to do its job. So that's pretty devastating if we lower the blood flow to the kidney. And then we have antacids like PPIs, proton pump inhibitors, which block the acid. And what can happen there is that you can get immune reactions to those medications. And now you create kidney tissue inflammation and damage. And one more thing that these acid blockers do is that they change the way your body absorbs things. And one of the things that suffers is that you're going to lose magnesium, or you're going to absorb less magnesium. So now you're going to throw off that balance between sodium and potassium and the other minerals even more. And another category of medication that damage kidneys is antibiotics, because there's several antibiotics that are directly tissue toxic to the kidneys, and it damages those tiny, tiny renal tubules and the filtering mechanism. Plus, they also damage the mitochondria in the kidneys. So again, now we have one more thing. We talked about how reduced blood flow provides less energy. Well, if we damage the mitochondria, now there's one more way that we reduce the energy supply to the kidney. So, if you really understand these four causes, the root causes, and you make sure that you avoid them early on, I believe that you can prevent the vast majority of kidney disease. And even in the early stages, I believe that you can reverse it. So, how do we do this? Well, I've done lots and lots of videos on each of these different steps and components. So, we're going to do a really quick run-through. First of all, you want to lower your blood glucose and your insulin, because insulin resistance is the #1 cause of kidney failure. And the way you do that is by eating whole food, quality food, unprocessed foods, and keeping the carbohydrates much, much lower than is generally recommended. I don't think that you have to be necessarily keto. You got to figure out what that is for you. But if your insulin and your blood sugar is high, you're eating too many carbs for you. Make sure that you lower your blood pressure if it is high. And don't do it with medication, because that again is toxic. Most high blood pressure is caused by insulin resistance and by stress and mineral deficiencies. So you want to supplement minerals, magnesium and potassium especially, and you want to work on stress reduction. So breathing exercises can lower your blood pressure 20 points in 5 minutes. And yes, it's temporary the first time, but if you do it over and over and over, you're entraining a skill and a habit in the body that reduces stress. And don't think of stress reduction the way most people do. They think that you have to avoid the world around you. You can't do that. It's not going anywhere. You have to change how you interpret it and how your body intuitively, instinctively react to it. Then you want to make sure that you hydrate smart, Drink water, yes, but also make sure that you get some balanced electrolytes. And you want to something that not just has sodium. You want the potassium, the magnesium, the calcium. You want some trace minerals. And my product even has some zinc and manganese because they have some specific benefits when you're trying to do some intermittent fasting and reduce insulin resistance. And then you want to eat the biggest variety of whole foods that you can come up with because the great variety provides a lot of different nutrients, but they also feed your microbiome the best way you can. And kidneys are also very sensitive to toxins and medications. So do what you can to reduce or eliminate toxins in your environment. Look at your cleaners. Use as little as possible. Use a healthy variety, a healthy version. And don't use medication unless you absolutely have to. And if you're on a prescription from a doctor, then obviously you want to check with that doctor first. But don't just gobble up over-the-counter medication as if they're candy. Take them if you absolutely have to. I haven't really taken anything in 20, 30 years. If this information changes the way you view your kidney health and the medical system's approach to chronic disease, please subscribe and like the channel. We are uncovering the health truths that have been overlooked for too long. Let's cultivate a healthier future together. The next vital insight will be revealed soon.